Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program for tonight in the studio Dr. Amr Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine at Ain Shams University. Thank you very much for being with us tonight, Doctor. And happy Ramadan.
Happy Ramadan to you, Ramadan Kareem.
You too. Of course, we did see a report about the efforts of the Egyptian government, and more specifically the Ministry of Health and the healthcare sector in general here in Egypt, to be alleviating the burdens of the Palestinians, and more specifically after 15 months of brutal aggression by the Israeli occupation forces against the Palestinians in the Gaza Strip and in Palestine in general. How do you see, first of all, the efforts that we have exerted in this field over the past year and a half, to say the least?
Well, this is definitely, we have to say that it's almost 18 months, like you have just said, from October 7 onwards. The Gaza Strip and the Western Bank has been always subjected to a lot of tyranny and a lot of brutal aggression, especially involving civilians. They say that the percentage of the dead and the dead among females and children is much more even among male adults. And this gives us an idea of how brutal has been the attack, with a lot of non-discrimination between military and citizens. And of course, when we talk about that, we have to emphasize the role of Egypt. Egypt has been always the force behind taking care of the Palestinians, of the Gaza Strip, whether this from 1948 until 1967, and afterwards, even after the Oslo Treaty, we can find that Egypt, and especially the Rafah gate, has been always the way of respiration of this valuable strip of land, carrying about 2 million people, what we can say the most heavily populated part of Earth on the Earth is in Gaza. So when we talk about this, we say that in spite of the fact that there was a lot of good hospital service before October 7, nowadays the health service has diminished up to almost zero or below. And therefore the role of Egyptian Ministry of Health and the Egyptian government and the Egyptian people as a sort of solidarity with them, as you have seen in the report before, since the 1st of February with the infliction of the temporary ceasefire, we have received almost 12,800 victims, whether these are victims of war, with all the turbulence of war injuries, which we'll talk about during the program, and the chronic patients. The chronic patients we have in any population, we have cardiac problems or chronic illness like cardiac problems or health problems in general, or cancer patients. All of these have either been delayed in their service presented to them due to the loss of the health service in the whole sector, or even misdiagnosed due to the lack of diagnostic measures. We have heard of how a lot of the sophisticated instruments that was there, whether these were MRI or CT scans or ultrasonics, instruments that have been placed in the Gaza Strip, have been demolished or destroyed. So we have to start from scratch dealing with these victims of war and victims of neglect. We are the Egyptian people, and we are the Ministry of Health that is receiving all these patients, trying to present to them just humane care. And of course, that's why the government not only allowed these patients to come in, but also to allow one or two of the associating family of these victims to come to them, to support them morally and psychologically, and giving them the boost.
Yes, Doctor, also we will be speaking about the humanitarian assistance, as you mentioned, by Egypt to the Palestinians, and more specifically to the Gaza Strip, after 15 or 18 months of genocide, war, and the brutal aggression conducted by the Israeli occupation forces against the Palestinians. But what are the main challenges, in your opinion, that are facing the Egyptian government, that are facing the healthcare sector here in Egypt, to be delivering the medical aid to the Palestinians?
Well, Egypt has given a priority to the service of these patients. We have the first line of defense are the hospitals that are fully staffed I think in Arish and in Rafah and all these areas surrounding the northern Sinai province and governorate, because it's very important to do a sort of sieving of patients, giving the primary health care, the primary diagnosis, and then directing them towards more specific hospital centers and treatment centers, of what we call the tertiary hospitals, like Ma'had Nasser or the Nasser Institute Hospital and other hospitals in the whole of Egypt. The effort that has been given to the government lately in the past 10 years definitely has given a boost to the health service in Egypt. We have seen the complete disappearance of hepatitis C. We have seen the monitoring of the tuberculosis. We have seen the monitoring and continuous vaccination of the polio vaccine to our youngsters. And the same thing, what the other sector or the other part on the borders, the Palestinians have suffered by the delay of giving them the vaccines of the polio for the new infants. We know that from the 2 million population of Gaza Strip, there are a lot of people, maybe more than half of them are below 18. All of them are needing a lot of important vaccines that were running out of function, running because of the loss of the refrigeration, or not present at all in toto. And of course this can put a big burden on the Egyptian government. The idea that Egypt has opened up its gates and allowing as much as possible, like they have said today, that until the end of February, which was 2 days ago, we have received 28 convoys. Every day there is a convoy of Palestinians who have been saved by the authorities on the occupation side to tell them that they have the priority to receive a treatment. When we talk about proper treatment and management and diagnosis and management, whether this is for cancer like chemotherapy or radiotherapy or surgery, this is a whole new chapter of burden on the economy of Egypt. And therefore Egypt, when it's going and presenting the plan of reconstruction of Gaza and leading the Arab world in the next summit and giving the idea how we should rehabilitate first of all the hospitals of Gaza in order to be able to receive more of the patients and to be self-sufficient. And it will take some time, but the concentration of the efforts of Egypt to supply these hospitals with their needs and their requirements definitely will have listening ears from the rest of the Arab world.
Yes, Doctor, of course we'll be anticipating the Arab League Summit, which will be taking place here in Cairo on the 4th of March. On the other hand, this brings us to the diplomatic role of Egypt, and not just the Egyptian authority, but the Palestinian institutions and the collaboration between Egypt and Palestine and the international organizations to be distributing the humanitarian assistance and the medical aid. How would you assess the efforts that we have exerted in this field already, and what is next to be done?
Well, definitely we have to compliment our government on two important things. Egypt has been mentioned as one of the key negotiators in bringing up this temporary ceasefire, in trying to bring both parties involved in this brutal war to the table of discussions and negotiations, harboring all the different points of views and trying to bring peace in this wretched piece of land. The idea of that is always in the decision maker of Egypt is to bring peace and to bring safety to the civilian population living there. We have to anticipate how much of suffering these people are going to suffer in the future, and we have to find ourselves more solutions. Therefore, with the initiative of Egypt of contacting with different European Union governments and all the negotiations that go as like going through, it's trying to bring in a sort of continuous feeding of information, of food, of supplies, of medical supplies, and definitely Egypt does not lack the expertise or the experience in the medical sector. We have to emphasize that the Egyptian sector, in the form of physicians and the rest of the supporting staff, whether this is nursing staff or all the types of people who are working in hospitals, is what we can call a very A-star staff. who have been dealing with a population of 107 million people.
Yes.
So when we talk about whatever the number of injured, whatever the number of diseased, we have the experience, we have the expertise to manage these situations. All what we need to do is the collaboration of the neighboring countries, is the participation of different donors to improve and validate the opinion of Egypt in bringing back health and a smile to the people living there.
Yes, Doctor, you mentioned the importance of collaboration between Egypt and Palestine and the international organizations as well, but how would you see the leap that we have had here under the tenure of President Abdel Fattah al-Sisi in terms of the infrastructure and more importantly in the level of hospitals that we have nowadays, which are being used for the treatment of Palestinians? Historically, this has been the role of Egypt and the role of the Egyptian hospitals. But how do you see the importance of this leap in infrastructure and more specifically in the field of the healthcare here in the country for the benefit of the Egyptians and for the benefit of the fellow Arab sisters and brothers?
Well, definitely we have to emphasize the role of Egypt in improving its health service. As I mentioned before in this program, how the health service progressed in the 50s and the early 60s by having these small centers and units of primary care in different villages, and how the central hospitals in the beginning were able to manage a lot of diseases, and therefore during the period from the first 5-year plan in 1961 onwards to 1966, we see improvement of health service, which has been shown into the age or the life expectancy of Egyptians. In the late 90s and the early 2000s, unfortunately, the population overgrowth and the lack of funds have definitely reduced the health care and has reached almost a sort of a dead end. With the initiatives done in the past 10 years, we have to emphasize the role of the government in, first of all, reducing the number of the waiting list of surgeries and trying to organize this, and at the same time the organization is very important. We have a lot of units and hospitals and centers and university hospitals and Ministry of Health hospitals who have been working, each of them, one of them as isolated island. Bringing the connection and the supporting computers that connect all these different systems of service and putting them into one strong system of control in order to know exactly what is the waiting list and how to direct patients to different aspects and prospects of hospitals where they can receive as early as possible the proper management, definitely improved the life expectancy and the chances of curing and services. And the second important point is dealing with chronic diseases. Whether this was hepatitis C, which has been the popularization of the medicine that has proved to be effective and therefore given to all the affected part of the population, leading to a dramatic reduction in the number of affected livers in Egypt. This is a very important step forward. The second important step is the care of the chronic illness and the early diagnosis of illness. So whether this is the complete scanning of breasts for cancer breast, which is responsible for killing a lot of young women if they are discovered late. So the early discovery and detection of this, the early discovery and detection of hypertension and of diabetes mellitus definitely has improved. And later on, perhaps 3 days ago, there was an important meeting about the rare health diseases and how Egypt is trying to take a role in early diagnosis and management of these rare health diseases. This is a system that should be going on. A country as big as Egypt is too big to fall. It's a very country liable to progress and come back and early as a real phoenix. And of course, Egypt is serving the Egyptians and the fellow Arab brothers and sisters. But how do you see the other side of the border, the Palestinians themselves? How do you see their perception of the efforts of Egypt on the diplomatic level and the humanitarian level in terms of giving and delivering the medical aid to the Palestinians in the Gaza Strip? How did you see the response of the Palestinians after, of course, the ceasefire? Nobody in Palestine, I believe, or the Palestinians can deny the role of Egypt in serving the Palestinian cause, not just in 1948, but before 1948.
Yes.
If you look at history in the 30s and the 40s, and the formation of the Egyptian League or the Arab League in 1946, you can see always how Egypt has been always a defending important part, and a non-aggressor defender, even during Nasser's time when he was approached by the Americans and he said, we can give peace to Israel as long as they are obeying and abiding by the rule of 1947. But the role of Egypt has been always in progress, whether after Camp David or later on during Mubarak's time, and definitely during President Sisi tenure. We can see how the Palestinians are perceiving the Egyptian care, and know for sure, and rest assured of them, is that they know what is who are with them and who have been supporting them all through the time. The people who gave them the education, the teachers that have served in their schools and the universities, they are either Egyptians or they have been trained and educated by Egyptians.
Yes, Doctor, allow me to be going to the other report of the daily debate for tonight, focusing on a lighter note, Ramadan and the health of the Egyptian families in the holy fasting month of Ramadan, as the Egyptian Healthcare Authority unveiled a new initiative for the Egyptians called Ramadan Health for Every Family in Egypt. We'll be having more details regarding such an important initiative for the holy fasting month of Ramadan in the upcoming report. Stay tuned.
As the holy month of Ramadan begins, the Egyptian healthcare system is implementing measures to ensure readiness during this significant period. The Egypt Healthcare Authority has launched Ramadan Health for Every Family campaign that targets to assist 105,000 people residing in governorates, including the Universal Health Insurance System. Supervised by 256 medical teams and mobile units, the initiative is actively in progress across governorates to guarantee extensive health insurance coverage and achieve the goals of the campaign. The head of Egypt Healthcare Authority emphasizes the importance of targeting individuals with chronic illnesses and elderly, recognizing their heightened need for continuous and specialized medical care. He reaffirms the campaign's commitment to running until the end of Ramadan. In addition to providing regular medical checkups and delivering medications to individuals with chronic illnesses at their homes, the initiative includes health awareness and education sessions. Educational pamphlets are also distributed to patients and their families to enhance understanding and promote healthier lifestyles within the community. In terms of healthcare infrastructure, Egypt is progressing with the second phase of its universal health insurance scheme with an estimated investment of 115 billion Egyptian pounds. This phase aims to expand healthcare coverage and improve service quality across the nation. The World Health Organization has highlighted specific health considerations during Ramadan, particularly for individuals with conditions like diabetes and for pregnant women. The communal nature of prayers and family gatherings during this period also necessitates vigilance to prevent the spread of illnesses, including respiratory diseases. In summary, while Egypt has introduced significant social and health care initiatives in preparations for Ramadan, addressing the concerns of healthcare professionals and ensuring the effective implementation of these programs remain critical to meeting the population's needs during the holy month.
Welcome back. You're still watching the Daily Debate, and I'm honored to be having with me over the program tonight Dr. Amr Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine, Ain Shams University. Thank you very much once again for being with us tonight.
It's a great pleasure, sir. Thank you
The pleasure is all mine. We will be speaking about Ramadan and the importance of staying healthy in Ramadan, because this is the point of it, of fasting for 30 days during the month. On the other hand, we have some rituals, some traditions, some family traditions that are hard to be staying healthy with at the same time. First of all, how do you see the importance of this initiative, Ramadan Health for Every Family, here in Egypt?
Well, it's very important because actually fasting will help a lot of patients and even normal citizens who can do a lot of checkups during fasting, because for example, the test for the lipids in blood has to be done with a fasting for almost 10 to 12 hours, and the same thing for the sugar in blood. So this will make life easier. If the patients do these investigations during their fasting, definitely they will have more or less accurate diagnosis of their condition. The second important point, we have known now that through the scientific progress, that how fasting is very important to lead a healthy life. And there has been a lot of schemes of diet control and food regulation based on the fasting technique. And in the fasting technique, the people would fast maybe 10 to 12 hours, and then they would have a meal, and then they will find a lot of improvement. So the choice of what we eat in the meal is the one which is hazardous, not the choice, not the fasting, it's in and out of itself.
Yes.
So if we are eating properly, healthy-wise, definitely Ramadan will be a very good chance to lose weight and most important of all, to feel healthy and definitely come out of it with better improvement in the health in general. So the idea of Ramadan as a sort of a month of overeating is definitely not the right thing. So definitely trying to look on this and emphasizing the role of early investigations and regular investigations can really help us to come out of Ramadan more healthier than we have.
To be eating too much and consuming too much, is this more about the culture, the mindset of the Egyptians, maybe the Arab states?
Definitely.
Or is it more about hunger and thirst?
No, it's definitely we have the misconception that we are really hungry in Ramadan, and therefore we are overeating at the time of breakfast. And usually what always keep ourselves reaching satiety or complete loss of hunger is by overeating stuff that definitely will fill the stomach and definitely will act as a burden. So consuming, for example, a lot of carbs and carbohydrates will take a small part of the stomach, so you will overeat of these carbs to fill in the stomach. While you can fill the stomach first early with a sort of a soup or a salad, will definitely help to reduce the hunger and therefore make us more sane in choosing what we are going to eat. And of course the difference between sanity and insanity is a very small piece of hair.
Especially when you're hungry.
Especially when you're hungry. That's why we should start eating after fasting in small portions and not overeating a lot of things, because usually the eye is more hungry than the real stomach.
On the other hand, in your opinion, as a doctor, if I came up to you and said, I want to stay healthy in Ramadan, and it's not just about eating too much or eating too little, or maybe in moderation at the time of breakfast and the thirst and what we have over breakfast, it's more about the lifestyle itself. How would you advise me to be going throughout the day in Ramadan without speaking too much about what I eat and what I consume?
Well, definitely you have to choose the type of food that is easily palatable, and at the same time fill in the stomach with a lot of salads and vegetables will definitely reduce the hunger and make us really get important information.
Yes.
And of course infusion with water is more important than juices, because the idea of bringing what we can call in the slang the sugar high, when people start eating sugars they feel very happy, and then the pancreas will start secreting insulin to control this gush of sugars that reach the blood and to reduce it on the spot, and this will stimulate more hunger for more sweets. So the idea is to control our intake of sweets, reduce the sweets as much as possible, and therefore this will definitely lead to improvement of your health. If we concentrate on eating sweets, this is very hazardous.
Yes, and speaking of the government and the efforts of the healthcare system here in Egypt to be adapting to the needs of the patients in Ramadan, the patients here in the country, do you think that a lot of things change during the holy fasting month of Ramadan in terms of the needs of the patients and what we have to be catering for from the healthcare authority and the Egyptian government?
Well, maybe the patients or the people in general will start to take life a bit easier. The weather or the cold weather will let them definitely not go out a lot into the streets, so this will reduce the rush hour if it's possible. But the most important thing is to understand or to propagate in the media about the healthy food. Of course, you would say that the high protein intake is definitely good, but this has any person giving advice about a proper meal should always consider in his way of presentation the amount and the economic situation of the people that you are talking to. So you should give ideas of healthy food within the reach of the hands of most of the Egyptians. And if we concentrate on this, definitely this will be a good message from the media and from the social media in particular.
In your opinion, what are the most common health issues that are facing the patients during the fasting month of Ramadan?
First of all, the dehydration can really affect the kidney and affect the fluid intake, and therefore we should drink a lot of water. Some people,
even if I don't feel like it?
Yes, because sometimes people would like to start their breakfast by drinking tea or coffee. And tea and coffee put more pressure on the kidney to excrete urine while you're already dehydrated, and so this could lead to a problem of formation of renal stones later on. So drinking water will definitely help to reduce this hazard. As much as possible, drink a lot of water, eat a lot of salads during the day, and consume, if you're going to consume proteins, we don't overuse the proteins. And 1 gram per kilogram body weight is quite enough. And this 1 gram of whole proteins is equivalent to 3 grams of meat or fish or chicken or whatever. And therefore, the 3 grams is almost 120 per kilogram body weight of a normal human being. So it's not a big amount of proteins, and therefore the proteins can be supplied, whether this is through pieces of meat or through milk or through other dairy products or even through eggs. So how to give this small amount of proteins without over exaggerating, give amount of salads, and prepare a healthy food with a reasonable budget. Definitely this is the challenge that we all as health givers and healthcare givers should always put in our mind in planning to our patients and our healthy population.
How can fasting be impacting negatively or positively patients with chronic diseases like blood pressure, for example, or diabetes?
Well, of course, people should take the medication properly. They should take the antihypertensive measures that they are taking. They should not neglect their diabetes dosage of every day, and should a physician tell him not to fast, he should obey.
Yes.
Because sometimes it could be hazardous. So sometimes fasting can really be very good for chronic diseases, and sometimes it's hazardous. And that's why in the Quran, whoever is not able to fast, God has given his permit to him to not to fast. So breaking the fast is not a crime. It is not a crime in the people who are obliged to break this fast because of their illness, and this has to be under the instructions of a physician. So taking care of the health and taking the medications in the proper time will definitely make fasting much easier and much doable.
Yes, and in terms of staffing, the measures that we can see at the hospitals and the clinics here in Egypt, there's always a new schedule for the fasting month of Ramadan. And we have spoken several times during the program here in the Daily Debate about the importance of hiring more people, hiring more staff, getting more doctors, because it is easier for them to be seeking other opportunities outside of Egypt. Do you think during the fasting month of Ramadan it is even more a bigger problem to be getting the staffing measures complete?
I want to tell you something about the Egyptian physician. Not a single sane person will go to the medical school unless he is morally motivated, psychologically motivated, having a dream in his life to alleviate the pains of the patients.
Yes.
And not a single person goes to medical school to become a millionaire, because they know in medicine you will never be a millionaire unless you start opening a hospital, so you are a businessman. but physicians work patient by patient, human being by human being. So they are different types of people. They are different type of human beings who have a lot of empathy, even more than sympathy. And that's what makes them going on. They are a treasure that we have to take care of. They are the people who are willing to sacrifice their lives for the life of others. And this is not a compliment, or this is not an exaggeration. This is true. The Egyptian physician has been always there. Even when Herodot visited Egypt, he said, in Egypt, the physicians are the best in the world. And yes, up till now, strange enough, this still goes on. The Egyptian physicians are the best, and therefore, whenever they go abroad, whether this is in Japan or America, from east to west, you can find an Egyptian physician giving proper care and proper health with complete dedication. So whether they are fasting or not fasting, you will find them there, and they will find them doing their job. And this is very important.
Yes, of course, and one important thing to be aiding the doctors and aiding the work of the doctors here in the country is the mass communication and the media and the social media as well, to be having social campaigns and the media awareness campaigns for the citizens during the holy fasting month of Ramadan to be staying healthy. Do you think that we need those campaigns, or
definitely
not?
Definitely. One of the most important problems that the healthcare system has faced in the 60s was the decrease in the number of the people started to survive with illness, but they didn't have good quality of life.
Yes.
Because they would take the pill of the hypertension only when they feel headache, or they will take the pill of the diabetes if they feel that they want to go to the bathroom. While if we give the social care and the mass communication, telling the patients that you will have to take the blood pressure tablet every day.
Yes.
You have to take the diabetes tablet in so and so. You have to take all your medications in the proper timing. This will improve the quality of life as much as it improved the quantity of life.
Yes, Dr. Amr Mabrouk, the Professor of Plastic Surgery at the Faculty of Medicine, Ain Shams University. Thank you very much for being with us tonight on the Daily Debate.
It's a great pleasure. Thank you, sir.
The pleasure is all mine. And this brings us to the end of the Daily Debate for tonight. Thank you for watching, and I'll be seeing you tomorrow.